Okay, hello everyone. Welcome to Being Patient Brain Talks. I'm Deborah Kahn, founder of Being Patient. Today, we are going to talk about optimizing cognitive function. In particular, can we make our memories better? Are we born with certain memories? And what can we really do to improve memory? Well, joining me today is Dr. Mark Desposito. He's a neurologist at UC Berkeley who has done a lot of research on cognitive function and joins us today. Dr. Desposito, thank you so much for joining us.
Thank you for inviting me.
Okay, let me just start with a very simple question, and that is, are we able to change our memories? Is there really a lot we can do to improve memory?
Well, I think, the word we use in neurology is plasticity, brain plasticity. And that just means how the brain changes. And the brain changes all the time. And we've really moved from kind of an old way of thinking that the brain, we're born with a set of neurons that we can't grow new neurons. We're born with a brain that is wired in a certain way that we can't change. And the real revolution over the last 20 years is that the brain has amazing plasticity where it can change and it could change it at any age. So that's what we've really been dialed in on is how how does that work and how can we change the brain, because we know we have much evidence that we can change the brain for the positive and improve cognitive function through how the brain reorganizes.
Okay, I want to explain my own experience with neuroplasticity because I didn't really understand it until maybe a few years back. My daughter was taking piano lessons and had no interest in piano. So I thought, oh, you know what? I'm going to just try to take some lessons because I hadn't played music since I was probably 8 years old. So I noticed when I started to learn piano again, all of my attention was on my left hand because I'm right-handed. I'm right, handed dominant. And then after about 6 months of playing every single day, I realized that equalized, and I was able to look at a sheet of music and not think only about my left hand, but I was thinking about my hands simultaneously, if that makes sense.
Mhm.
And then I thought, is that neuroplasticity? Because now I'm capable of doing something I couldn't do 6 months ago. What's happening in my brain then, and why?
Right. So that is plasticity. That's a great example of plasticity. And it's not that the brain grew new neurons, that you all suddenly, grew a new brain area and new neurons that are able to get your left hand working. It's actually the neurons that we have reorganized. So the brain is organized in a network, and it's organized very much like other networks, the electrical grid, airline networks, social networks, and it's built by modules. And what we mean by modules is they're networks that are very specific for certain things. So one module for motor function, and one module maybe for language, and one module for visual spatial abilities. And what happens in brain plasticity is not that those individual modules changes, it's the way they talk to each other. So you had modules that were capable of doing, using both hands, but they never communicated with each other because you hadn't learned that skill. And so as you learn that skill, it's actually these modules more integrating and talking to each other and the brain reorganizes in a way that it forms new connections between these modules, so that you're able to now sort of be less lateralized, less dominant on one side and more kind of ambidextrous. And that's exactly what brain plasticity is, kind of reconfiguring of brain networks that we already have.
And why is that good for our brains? I mean, I guess it's the same thing that happens when you learn a different foreign language. It's like you're sending your brain signals in different patterns. But why does that equate to brain health?
Well, brain health is a complicated term, but I'm glad that it's on everyone's radar now, because brain health on one end of the spectrum of brain health is that it's like any other organ. It needs oxygen, and it needs blood flow. So brain health really also means good vascular health, that we need to have vessels that are not clogged with atherosclerosis. We need to be healthy. We need to sleep, that every organ needs. But then on the other hand, brain health is how are our neurons doing? And neurons are this unique thing that are so different than every other cell, in every other organ. So that part of brain health and neuron health is I think what we've learned is that when networks are more integrated and more communicating and able to really take information from all different walks of life and pull it together is when our brain is the healthiest, that we're not so stuck in sort of very rigid, sort of bottom up kind of automatic behaviors, but more kind of flexible, goal oriented sort of behaviors.
So I want to talk specifically now about memory. When you speak, I've listened to other interviews you've done, and you speak in terms of working memory versus long-term memory. Is working memory the same thing as short-term memory, or is it different?
Yeah, it's different at a theoretical sort of perspective, but essentially it's the same. When I talk about memory, the important thing to know is memory is not a unitary function. We sort of think about memory as just one thing, but it's actually many different things. And the reason why we know that is because there's different parts of the brain that support different types of memory. So what I mean by long-term memory is information that we've learned what we had for breakfast today, the last vacation on all the episodes that we store over time and then able to retrieve. And that's what we call long-term memory. And that kind of memory is supported by a part of the brain called the hippocampus. But then there's an entirely different kind of memory, which we call working memory, which is just the memory that we use to hold information online in real time when it's not there. So if I tell you my telephone number and you've got to type it into your phone, you have to hold those numbers online. When you're listening to a conversation, you have to hold, the beginning of my sentence is gone, but you still remember what it is. Again, that's kind of online memory that's there as long as you need it, and then it disappears. And that's what we call working memory. In the clinical world, we call it short-term memory. There are some theoretical distinctions between the two, but working memory really was a newer term because it has to do with more kind of how we use. Not only do we sort of passively hold it, but we kind of can manipulate it in our head as well. That's kind of the working part.
So is that not going on in the hippocampus? Does that take place in another part of the brain?
Yeah, so that's the frontal lobes seem to be most important for that. So we've got two different memory systems that are supporting different kinds of memory. That's why we can have patients that have good long-term memory and bad working memory, and vice versa, where they have bad working memory and good long-term memory. And that's actually an avenue into therapy, is where we can try and use another system to kind of take over or help compensate for the weakened system.
Okay, so I'm fascinated by this because I've spoken to, I've interviewed many neurologists, and they assure me, because I've always thought I don't have very good memory. Like I'm the type of person who can't remember anyone's face or name. I'll see a movie and a year later I will not remember what it's about. And the question that is thrown back at me is, well, have you always been that way? And I say yes, and okay, well then that's okay, right? It's just the way your memory works. But I question that, because I wonder if there is a deficit within my brain that I could actually make better. And so I'm fascinated by this compensation between two different systems. Can we help improve one? If one of them has a deficit, can the other one help improve it?
Yeah, so we can definitely boost memory. We can boost our working memory capacity. If I sort of test you and see how many numbers you can remember, it might be 6 or 7 numbers. And if we train you, we can get that capacity up for sure. And same thing with memory. With long-term memory, you can boost with training, you can boost your episodic memories. But I'd be hesitant to use the word deficit when we're talking about healthy people, because I think it's just a bell curve and just reflects individual differences. So for every ability, reading, writing, whatever it is, I'm a very slow reader, so I'm on one end. But so I would say if we're on one end, we have a deficit. We're just on one end of the spectrum. But we can sort of push you more toward. We can push you towards more optimal functioning with training for sure.
So what does that look like? How do we improve our memory? I mean, I think that's what a lot of people in our audience want to know, especially if they have a family member diagnosed, with Alzheimer's disease or a different dementia. Like, are there things we can do to really boost our memory and, overall brain health, to avoid the tipping point of dementia?
Yeah, so I think, again, if we think about disease with patients that have a working memory deficit, then there are very focused cognitive training protocols that can focus in on working memory and try to boost that. Or if they have an episodic, long-term memory deficit, kind of boost that. And that's targeted because it is below, it's off the end of the bell curve, and we're trying to boost it back to sort of normal, and because it's leading to functional deficits. But you or I, who maybe our working memory capacities on the lower end or the episodic memory, it's not necessarily leading to a deficit, because we've that's how we are, that's how we're built, and we've learned to sort of deal with it, right? And so the question is whether we need to focus on these sort of very specific problems like remembering names, or should we focus on brain health more generally? So I'm of the opinion that we should boost our brain health more generally, that I wouldn't spend a lot of time trying to improve my ability to remember people's names if that's just how I am. Just like I don't spend a lot of time trying to learn how to read faster, but I do try to. But if you improve, the concentration should be on brain health sort of generally, and the kind of things that help improve brain health is, from a cognitive training standpoint, are all those types of things that kind of improve, that kind of are sort of the highest level of abilities, the things where we have to integrate information. So rather than sort of learning, boosting our vocabulary or sort of boosting our ability at puzzles, focus on things that actually are with problem solving, that involve sort of integrating sort of many different types of abilities, like learning how to cook a meal, or plan a family a vacation, or plant a garden. Those will tap into all the different abilities, and I think would have the biggest impact on improving brain health and focusing on a very specific ability.
What about in terms of, I mean, I know you've spoken in the past about dopamine and the role of memory, and there are like supplements, medications that people that I think you've even researched. So what do we know about really like chemical in our brain that we do we have control over finding out A, where the deficiency is, and B, treating those deficiencies through supplements or medications?
Yeah, well, the chemistry of the brain is fascinating, and it really hasn't been given as much attention as I think it should. We did learn a very long time ago that in Alzheimer's disease, for example, is a deficiency of acetylcholine, which is one of the neurochemicals in the brain, and that's why the first approved drug for Alzheimer's disease was a drug, and still is a drug, that boosts the amount of acetylcholine in the brain, because long-term memory depends on acetylcholine. So by boosting acetylcholine, we can improve long-term memory. But then on the flip side, another neurochemical, dopamine, seems to be the chemical that's most important for working memory. And we know that if you have a deficiency of dopamine, such as in Parkinson's disease, that you'll have problems with working memory. If we boost dopamine, patients will be better in their working memory. So, for example, in a Parkinson's patients, before they're taking their meds and after they take their medications, when we give them more dopamine, they're better. So that's definitely true for patients that have known deficiencies. The issue is what about healthy individuals? And again, it's a bell curve, and there's individual differences, and there's many people who are deficient probably in acetylcholine or dopamine and don't know it. And so that's the problem. We don't have a blood test that can tell us if we're deficient in these neurochemicals. There's an enzyme in the brain that breaks down dopamine, and if you're deficient in this enzyme, you can have actually less dopamine, just baseline, and not really know it. And if we were to give you dopamine, you would improve your working memory. So I think the goal is to try and develop blood tests that actually can measure dopamine, so we can intelligently know if you should be supplementing or not. So I wouldn't recommend just supplementing dopamine, because it turns out that if you take the way neurochemicals work is it's not more is better. There's actually an optimal amount. So if you take too much, you actually can get worse. So I think our goal in medicine is to try and establish sort of what our own personal neurochemistry is, and then try to target these supplements to those who need it.
How hard would that be though to understand how much acetylcholine or dopamine is in your brain? I mean, I guess if it's in you can if there is a blood test, will that measure the amount that's actually in the brain?
Yeah, so that's the problem. So we have there's a test called positron emission tomography, which can actually take dopamine and acetylcholine and label it in a way that we can measure in the brain. So it's invasive. It involves injecting a radioisotope. It's expensive, but we've done studies where we've measured dopamine in the brain of healthy undergraduates at Berkeley, and it perfectly correlates with how well their working memory is. The more dopamine in the brain that we know for sure we can measure does translate to working memory, increased working memory capacity. So I could see somewhere there becoming a test like PET that's not invasive and and can measure these neurochemicals, but they're not there yet. And like you said, the blood is a problem because we don't know. The blood is not a really good marker of how much is in the brain. And not only does it sort of tell us how much is in the brain, but we don't know where it is in the brain if we measure it from blood. So that's why right now we don't have that. We do have tests for the enzyme. We can measure whether your enzyme is deficient, but that's not part of standard clinical practice right now.
Prevention is never part of standard clinical practice. It feels like more times than not, right?
Exactly. That's not something that a neurologist is going to do. But when we shift towards become brain health as opposed to brain disease and get more on the offensive side of the defense, we will start doing these tests to try and prevent decline.
Did you hear that, insurance companies? We need preventative medication to be preventative strategies to be covered. I have a question.
If I can just sort of add to that, not only insurance companies, but pharmaceutical companies. So there's not a single drug that's been developed just to improve cognitive function. Uh,
And do
and
you think we have the capability to do that now? I mean, would that be an easy thing to do?
Well, we already have the drugs. So we have drugs
So
that,
acetylcholine, like if I had a mom with
yeah,
Alzheimer's, would I be put on, well, if it was determined I had a lower level of acetylcholine, then that would be a natural thing to go on in order as a prevention strategy?
right. So for example, the drugs for dopamine are for Parkinson's, is developed for Parkinson's disease, but we've given them to healthy young adults who have this enzyme that decreases the amount of dopamine, and we improve their working memory. So we have to co-opt sort of drugs that are already approved for other diseases. So what I'm advocating is that the pharmaceutical companies, sure, try to develop drugs that target diseases, but target uh, cognitive function, which is not a disease, right? Which is not a
Right.
disease, and that's why they don't target it.
But I have a question about the level of neurochemicals. So for example, when I'm a runner, when I go for a run, I get a rush of endorphins, right? But if you're measuring, if you get a PET scan for the amount of dopamine or acetylcholine in your brain, wouldn't that change according to what hour and what you've been doing, or is it pretty much a constant?
Yeah, absolutely. Well, there's two levels. There's definitely kind of what we call sort of a tonic level, and that's what we're measuring, and that's pretty stable. That pretty much is stable no matter when you measure it. And then there is this phase, what we call phasic, where it will change from moment to moment. And so that's what makes it complicated because dopamine has a role. Just baseline dopamine has a role, and then sort of tonic, sort of then phasic dopamine has a different role. So it might be more complicated than just sort of boosting your baseline level.
Right. We have a question coming in from Nancy who said, thank you for this conversation. I'm curious about how trauma affects memory. What do we know about that?
Well, I'm not sure if she's referring to emotional trauma or
Yeah,
actual
or
physical
physical
trauma, right?
trauma.
But I can answer both. I mean, I think on the emotional trauma side, emotion is a very important factor in sort of how we remember information. And so we all remember information better when it's emotionally tagged, when there's some emotion tag. So if it on one extreme, if something tragic happens like 9/11, the memories are much more vivid later on. Or if it's something that just we got embarrassed, we'll always kind of remember that moment as well. So it's significantly tied. The more emotion, the more emotion involved in sort of the episode, the better we will remember it. On the physical side, when the brain has trauma, it tends to affect the part of the brain that gets most affected are the frontal lobes, just because of the way the brain is, the skull under the brain is irregular and is banged against the skull. So patients with physical trauma to the brain tend to have more working memory deficits, so they tend to have more of a decrease in dopamine than acetylcholine.
So how much is energy? Okay, so what I've interviewed scientists who have said that there is energy source, like keeping, I guess we naturally metabolize glucose as a source of fuel for the brain, but another alternative source of fuel is ketones, which we derive from fat, which cross the brain blood barrier. So there's a hypothesis out there that if you can boost your brain energy and keep it, because as we age, I guess I've been told we metabolize glucose not as efficiently. That's just part of aging. So is it possible that creating maybe going from ketones to glucose, that could actually be good for our brains, because what we're doing is taking an alternative source of fuel and fueling our brains? And I'm saying
Yeah.
this in obviously very
No,
lay
I get it. I mean, anything that increases energy is going to be good for brain health. And oxygen, I'll get to oxygen in a second, but if we just sort of talk about energy, we can go back to how we think about networks. So we think about the brain is full of networks and it requires energy, but it's organized in with these hubs where some parts of the brain are more important than the other parts of the brain. So if you think about like an airline network, right? It's got there's airports everywhere, but there are only a few that are really important networks, like Chicago and Dallas, right? So if you're trying to get from New York to San Francisco, even though you're not going through Chicago, if something's happening in Chicago, you might get delayed because it's this incredibly important, busy hub. Whereas Milwaukee, for example, something might be going down there and you might not even notice it. So it turns out that there's hubs. That's how the brain is organized. So certain regions are hubs, and we call them the most biologically costly. They're taking the most energy. So by boosting the energy, we're actually improving these hubs we're kind of improving this hub function. So that's why sort of improving energy doesn't just uh, help the brain overall, it actually targets it to the most important parts of the brain. And then on the oxygen side, sort of oxygen also helps hubs, and any way we can get more oxygen, just obviously the exercise is the best way to sort of improve oxygen to the brain, and that will also sort of improve the function of these critical brain areas.
Right. We're getting another question in right now. This is from a viewer, Kathy, who said that she's talking about her dad's girlfriend, who she's been helping care for, and who has been prescribed Aricept. And she said she started on 5 milligrams, and shortly after she noticed that she stopped socializing. But then they boosted her to 10 milligrams, and then she actually was worse in terms of socialization and not eating her meals. So then they even boosted it even higher. So I this is quite a long message, but I think the point is there, she said she won't socialize at all anymore, and so how does she help her re-engage? And I don't know if there's a possible side effect to Aricept. Is Aricept actually the acetylcholine? Is that correct, or is it a different?
Yeah, so Aricept boosts acetylcholine, and in patients with Alzheimer's, it's been shown it can improve memory, maybe slow the course. That's why it's improved. But for unknown reasons, sometimes the link between acetylcholine and long-term memory, that I don't want to imply that that's the only thing that acetylcholine does. These neurochemicals support a lot of different functions in the brain, and long-term memory is one of them. And so it's very complicated. So sometimes we do get side effects with these medications that are because of its function in other areas. And we don't understand why some patients will have side effects like that and others don't. In my experience with treating patients with Alzheimer's disease, sometimes the acetylcholine has sort of side effects because the patient doesn't have Alzheimer's disease. Actually, they have some other form of dementia, maybe frontal temporal dementia or Lewy body disease, and then the acetylcholine doesn't, is going to act in a very different way. So sometimes, to me, that's sort of a clue, is that I should kind of think about the diagnosis. But I think if with any side effect, we certainly stop the medication. There's other Aricept, there's 2 or 3 other medications that can boost acetylcholine, and sometimes a different one will work and not give the side effect that another one does.
Yeah, interesting. I was interviewing, you might know her, Dr. Claudia Callas, who's done the 90 plus study, which is a fascinating study. You have to be 90 years to go in, and it's been going on for 18 years. They've, had people in it who have beta amyloid plaque in their brain and never got Alzheimer's, and I asked her what was the one commonality, and she said socialization. A lot of, she actually said 8 hours of socialization a day. And I thought, wow, who has time and to socialize for 8 hours a day? But I guess when you're 90, you do. But the question is, what do we know about socialization? And when you look at, the blue zones where people are living past 100, there are village settings where there's a lot of community in there. What do we actually know about socialization and the brain? Do we know why it's good for our brains?
Yeah, I mean, that's a fascinating topic that's getting increasing traction. It's funny you mentioned this story because recently one of my good friends' mom turned 90 and she had 150 people show up to her birthday party. And I was thinking, if I have 150 people for my birthday, that will be an amazing achievement. But I think that's why she's incredibly healthy, plays golf and does all these things because she has 150 friends that she's connected to. Um, there's a project that I'm involved with called the Brain Health Project, and I don't know if you're aware of this. It's run out of UT Dallas. It's the director of the project is Dr. Sandy Chapman, and the goal is to enroll 100,000 people into this study in order to try and develop an index of brain health and try to develop ways to improve brain health. And so it's mirrored after the Framingham Heart Study, which followed individuals for many, many years and still is, and was revolutionary in terms of determining cardiac health. It's why we know you need to lower your cholesterol and lower your blood pressure. Well, we want to know what do we need to do to improve brain health, and also how do we measure brain health? Because to me, what's so frustrating is that when you go to your family doctor, every organ in the body is examined except for your brain, right? And it's not the fault of family physicians, it's just that we haven't given them the tools to measure brain health. So part of it is sort of developing a brain health index. And so their brain health index is very broad. It measures a lot of cognitive things. It measures many real life things like exercise and nutrition. It measures well-being things like stress and quality of life, but it also has a bunch of measurements about social measurements, how socially engaged you are, how kind you are, how much social support you have. And then they've already enrolled over 30,000 individuals. And when they're starting to look at the data, there are three kind of factors that seem to most predict brain health. One obviously is cognitive, sort of the higher level cognitive abilities. A second is sort of one's mood state. But the third was actually social connectedness was as critical a factor to brain health as these other factors. And so now it's on our radar how important sort of social connectedness, and I think it gets back to sort of how you boost networks, how you improve sort of networks. It's just that's what you do when you're socially, right? That's what you do when you're socially connected. You boost the ability of networks to talk to each other, and you have a more sort of integrated kind of brain. So I think there's a real biological basis to social connectedness. They may turn out maybe one of the easiest things it's free, right? To
Yeah.
me.
Absolutely. I mean, and I think the way that it's been described to me is like when we're having a conversation, I'm like listening to what you're saying, I'm analyzing it, I'm pulling memories of things that I have in my brain to compare it with, and then I'm articulating a response, right? So that's using your brain, right?
Yeah, and we're
I mean,
not just I'm not just drilling you on, vocabulary words or anything, where it's like you said, it's sort of pulling your brain into all different directions.
yeah. So I just wanted to touch a little bit on supplements. I mean, our frustration over supplements are that there's, that's a gazillion-dollar industry that's profiting greatly. But the consumer, it's very hard for the consumer to understand what works and what doesn't, because supplements aren't put under the same rigor as pharmaceutical, drugs. So how do we know? Is there anything, I mean, maybe I should start with is there anything you take that we should know about? And how do we know that it's actually benefiting our brains, or do we not?
Yeah, so I don't. I mean, I've really concentrated on a healthy diet. I sort of feel if you have the right that you can get most of what your brain needs. You should get everything that the brain needs through your diet, and so that's I think that's the best way to get your to improve brain health. But I do think there's going to be a role of supplements. We do know that there's there are individuals, like I said, that have less dopamine and they might have less acetylcholine or they may have less B12 or whatever it is. And if we can measure that, then that's where there's a role of supplements. There are supplements that can boost acetylcholine and dopamine, but again, we don't, unless we know you're deficient, I wouldn't recommend sort of taking them because you're doing it blindly. And like I said, you can actually take too much. You can sort of you can take too much. And so I think we first need to there needs to be a much bigger push towards measuring our own personal neurochemistry. And then I think there will be a big role for nutritional supplements when we can do it in a logical sort of way.
Yeah, and Leah's just asking as a follow-up, do you have an opinion of the new monoclonal antibody therapies out to treat, disease modifying to treat Alzheimer's, like Leqembi, which is currently, or lecanemab, currently on market. Do you have an opinion about those drugs and their efficacy?
Well, I think my opinion is pretty much is similar to what all of the panels and real experts in Alzheimer's disease. I think it is what it is. We know, so all we know is from what our observations are, and so yeah, I think what's been kind of very frustrating is that none of the medications, right, for Alzheimer's has been the big blockbusters that we're looking for, but but I agree with all the studies that there is some effect. It's just not the kind of big effect that we've been hoping for.
Yeah, absolutely. But I guess, it's the beginning of hopefully what will be a new way, with a combination of other drugs and targets to treat Alzheimer's disease.
Right.
But okay, well, thank you so much, Dr. Esposito, for your time. Hugely interesting. We would love to post the links to that study you mentioned. So we'll get that from you and we'll post it on this Facebook Live. You mentioned the brain health study. Happy to post that and any other studies on brain health, because I know our community is highly engaged and interested in learning about the latest research. So thank you for your time and your expertise.
Thank you. It was a lot of fun.
So if you've missed any of this interview, don't forget we post it on beingpatient.com. Sign up for our newsletter. Every week we send out the latest roundup and you'll get to know about interviews like these. So thanks everyone for watching and we will see you next time.